cooler out.
Gotta get my hands warm. I was afraid my arms would get tired. Right? Okay. Sure. I was ready for the MC role, but I'm happy whoever you want to do it. See on the list. Yeah. Okay. Yes.
Very good.
We'll get this.
Everyone ready? Is everyone ready? Good morning, and thank you for joining us here today at the Erie County Rath Building as we come together on Suicide Awareness Prevention Day. We have a tremendous group of individuals here from the Suicide Prevention Coalition of Erie County and Western New York, and you'll hear from some of them as we discuss why September 10th is not only annually but globally known as Suicide Awareness Prevention Day, and how we as a community must come together to work together to save as many lives from people who are in distress. I'm Erie County Executive Mark Polenkars, and I'm joined here with Kendra Schmidt from Deaf Access Services, who's providing our American Sign Language for our people at home. While you don't see them in the picture, I'm also glad to note we have some of our partners in government that are here. I see Assemblymember William Conrad is here, as well as legislators Lisa Shamera and Frank Tadaro. So thank you, legislators, for being here. And it just goes to show the community that is coming together for a very important issue, which is the prevention of suicides. I first off want to thank everybody that's standing here for the tremendous work that they've done over the last few years. We have the statistical data that shows over the last 3 years, suicides continue to decline in Erie County. That's a great fact, but there are still, unfortunately, individuals who are taking their lives in our community. So I do want to thank and commend every one of the members of the Prevention Coalition and Task Force. Because of your great work, we have seen a declination each year for the last 3 years in suicides in Erie County, but we're one of the only counties, it seems like, in the United States where that is a fact. And it goes to show you need to have a united effort from people across the entire spectrum of a community to reach out to those that are in need and distress and let them know hope for a better future does exist. It may seem the darkest day you will ever face and it will never get better, but it will get better. And to the people who are here today who help spread that message, I want to say to you, thank you. Thank you. Your good work has saved lives in our community, and that is a testament to the time and effort that people put in to address this significant issue of suicides. But as I noted, unfortunately, there are still individuals in our community who see no hope, who see no way forward, and unfortunately, they take the final act, the most drastic act, which may end their pain, suffering, but unfortunately causes pain and suffering for everyone around them. So to those who are out there who may be thinking it's never going to get any better, I don't have anyone who cares about me, please know every single person here cares about you. You matter to us, and we know it will get better. We know better and brighter days are ahead. You just have to trust us. You have to believe us. And you have to talk to the folks that are here, some of which will talk about the services that are available to ensure that you do understand that brighter and better days do lie ahead for you. And we care about you in a way that you will never understand. So on behalf of the people of Erie County, my colleagues in government, I want to thank all of our partners here today. At the end of this conference, we will be raising the flag with regards to suicide prevention awareness. This is not only Suicide Prevention Awareness Month, it's Suicide Prevention Awareness Week and Day. And we put the time and effort in September to ensure that people understand that you do matter and we are here to help you in your time of need. And one of the organizations that works more than many others to ensure that others know that they are loved, they are cared for, and their help is available is Crisis Services. And it's my pleasure to introduce to the podium right now the CEO of Crisis Services, Jessica Pirro, and to thank her for her organization's work to ensure that people understand that a brighter day does lie ahead for all. Jessica?
Thank you so much, County Executive Polenkars, and we're so honored to be here with you again today for our Flag of Hope event. This is actually our 6th year of raising the Flag of Hope. Last year, obviously, we took a little detour, and that flag was actually carried around our county by all of our partners that you see behind us with pictures that we put to a video because we couldn't be together to honor World Suicide Prevention Day. So we're excited to be back with everyone today to really highlight the work in our community that's being done to prevent suicides, to let people know that they're not alone, and that there is help, hope, and there's a future ahead. I first want to just take a minute to recognize our Coalition Executive Committee members, Matthew Smith from Prevention Focus, Robert Canada from Spectrum Human Services, and also I am the chair of the coalition. So we're very honored to have you all with us today. And Celia Spicone, who is our coordinator of the coalition, will be speaking to you about all of the efforts that our membership has done over this past year and other projects that we have ahead. I just want to take a minute to talk about services. I know the county executive mentioned that. I think all of us in all of the agencies, their signs are here, their names are here. There's many partners in this community who are ready, willing, and able to help anyone in crisis, anyone who needs help, anyone who has questions, for family members who might need support on how to speak with somebody who might be struggling. We are all here. Crisis Services is the 24-hour crisis center for our county. Our 24-hour hotline is 834-3131. We were excited over the last several weeks to be launching our text and chat option that is running Monday through Friday from 6 to 11 p.m. And you can find that information at our crisisservices.org website. We are trying to continue to improve access to services, to enhance people to know that there's always going to be somebody that there's available to speak with you. And on behalf of myself at Crisis Services, my amazing team members that are here today who are doing this work each and every day, responding to those in crisis in our community, and really providing that safety, help, and hope, which is the vision of Crisis Services. So on behalf of the coalition, on behalf of Crisis Services, I want to thank our entire membership for their hard work and dedication to this issue. We make strides, but there's days that we don't. And this work only continues, and we really need the team behind us to make this a success for Erie County. So on behalf of all of us, thank you for being here. For anyone out there who needs help, know that we're here. Please call Crisis Services 24/7, 834-3131. I want to now introduce our Erie County Commissioner of Mental Health, Mark O'Brien.
Thank you, Jessica. Good morning, everybody. First of all, I would like to thank the county executive for his unwavering support in these initiatives and all the mental health services that are provided in the county. It's really truly been an honor. And I also want to thank the legislature who have been really risen to the task all the time with their support of the services and what they do. I also like to thank the leadership and the members of the Suicide Prevention Coalition of Erie County. They're a very involved, interactive group that have provided leadership and guidance for our efforts for suicide awareness and prevention. They do a lot of public education, and they also do some very interactive events. For example, one thing they call Project Means Reduction, where they go out to gun shows and advocate for safe storage of firearms and how to safely put them away so that they're out of danger, because as we know, firearms are very unforgiving. They're one of the primary means of suicide, completed suicide. So to have those and buy some time for people to have that time between that moment of crisis and that moment of decision, that's really the key to reducing suicide. We know that COVID has increased separation and isolation as people have been suffering with this. They've also been suffering in terms of anxiety and depression and related to worrying about what's going to happen with them or their loved ones, and in some cases losses they've felt. So these factors have all impacted people's sense of stability and led to increases over the course of time in suicide. There's three factors that are really protective factors that when people think about suicide, where these exist, you'll see a decrease in suicide. And that is purpose, hope, and connection. And those are three things that all of us can help for ourselves, our families, when we have something that's bigger than ourselves, something to put our efforts towards and a way to connect with others around it. That sense of isolation decreases. Another thing we want to talk about very, very briefly is recent events in the world and in Afghanistan have been very triggering for veterans, both veterans of the Iraq War, Afghanistan, and our Vietnam veterans. So if you are aware of veterans, this is a time to reach out to them, lend an ear. And for veterans or for anybody, no one ever gives anybody the idea of suicide by asking about it. When people can talk, it's a load shared. So I want to encourage people that if you're worried about somebody and you think they're thinking about suicide, ask them about that. You will not give them that. You will give them a source of relief and support, and then help direct them to where they can get some professional help and support. I do want to remind everybody of the crisis services number, 834-3131. That's available 24/7, and we are anticipating the introduction of the National Suicide Prevention Hotline. The 988 number, it's not online yet. We expect that to be implemented shortly, and so we're looking forward to that. So, and lastly, we do want to remember those that have lost their lives on September 11th, those heroes that gave their lives, and those who suffered after. So we want to make sure we keep them in our thoughts and prayers. So with that, I would like to introduce the Erie County Commissioner of Health, Dr. Gail Burstein.
Thank you. Yes. So good morning, and thanks everybody for joining us this morning for this very important event. So as you know, I'm Dr. Gail Burstein, the Erie County Health Commissioner. And I just want to talk about the losses in our community. So when our community experiences, when somebody dies from suicide, that's a tragedy for all of us. It's also painful, and it's also a preventable loss. However, events like this one today are very important. We can together combine our resources and our purposes of healing, recovery, and hope while shining a spotlight at what can be done to prevent suicide. But every day we have a responsibility to support initiatives that eliminate stigma and to incorporate compassion and empathy in how we talk about suicide. Behind each of these deaths by suicide investigated by our medical examiner's office, there's a unique individual whose story has an ultimate and preventable sad ending. There have been 37 of those stories so far this year, with another 8 people who are pending confirmation of potential suicide. While we can say that the number of deaths by suicide since 2018 has actually decreased, as the county executive mentioned, thanks to all the efforts of many of the people here, we must always say that we want that number to be 0. Our partners with Crisis Servicers, the Suicide Prevention Coalition, and the Department of Mental Health have kept this issue at the center of their work, and their efforts to increase awareness and decrease stigma are deeply appreciated by those of us in public health. So thanks to all. And so now I am going to turn it over to Celia Spicone, who is the coordinator of the Suicide Prevention Coalition of Erie County.
Thank you, Dr. Burstein, and thank you all for joining us here today. Your presence sends a strong message out to the community that you care about preventing suicide and that there is help available, and when there is help, there is hope. The Erie County Coalition is recognized throughout New York State as one of the most active and effective coalitions. Its membership has grown to 45 agencies, organizations, hospitals, and stakeholders. During this last very challenging year, the work of the coalition never stopped. We met virtually and even increased training as we became facile with Zoom. While our efforts are beginning to show success with the suicide rate going down in Erie County, we firmly believe that even one suicide death is one too many, and thus we will continue our efforts. A strength of the coalition is that we believe in informing our work with research and data, which is produced locally by the medical examiner's office. It helps us focus our efforts and our interventions. Over the last year, that has led to the following interventions. We continued efforts to ensure that school staff are trained to know the risk factors, warning signs, and how to get a student help. To date, over 6,000 Erie County teachers, aides, bus drivers, cafeteria workers, and support staff have received this training. Our subcommittees have worked to develop a more seamless coordination among schools, parents, and the mental health community, and make sure that school staff have the training and resources they need. We trained over 400 citizens in the basics of what a community needs to know to help prevent suicide. And with the additional stress that the pandemic brought on, we focused on awareness and prevention training in the workforce, for first responders, and for our medical community. We recognized this year we had to do a better job reaching out to communities of color, so we started a committee that produced training specific to the needs of diverse cultural groups. The evidence is now mounting that reducing access to lethal means for suicide is a critical factor to help prevent suicide. Studies show that the average time for making the decision to act on suicide in about 50% of suicide attempts and actually making the act is less than about 15 minutes. It is important to put time and distance between a person who plans to take their life and a lethal method for doing so. Using a very lethal method like a firearm does not usually give a person a second chance. Time to get to a method gives people a chance to rethink their decision. So our lethal means education initiatives included counseling on access to lethal means provided to almost 50 counselors in Western New York. And we partnered with the VA, AFSP, and the Erie County Department of Health. And during the COVID pandemic, we gave out free gun locks and means reduction materials, keychains with the crisis services number out at the COVID testing sites. Close to 600 gun locks were distributed. We created an online interactive map that's on our website. This is a place where a firearm owner can go to find a place to temporarily and voluntarily remove their firearm from the home during the time of a crisis in the family, a mental health crisis. It's something they can choose to do to take responsibility to keep their family safe. Finally, we worked with White Bicycle Design, Tom Vetter, and Mark DePalma to produce a short training video on firearm safety and suicide prevention. Local people, veterans, Terry Sloan, Kelly Asher, a hunter, Grant Vincent, and his wife, Dr. Kirsten Vincent, and Buffalo police officer Tony LeBrun were featured in this video with the voice of Steve Cishon. We hope this video will increase awareness of safety and be used in firearm safety training. It's just been put on our website, suicidepreventionecny.org, and it's called Time and Distance, Suicide Prevention. I'd like to introduce you to a few people relative to that. First of all, Dr. Kirsten Vincent participated and was filmed for this video. Sadly and tragically, about 2 weeks after the filming, she passed away due to an acute medical crisis. We have dedicated the video in her memory, and we have here today the members of the Vincent family. If you would step forward. Husband Grant, children Kelly, Julie, and Peter, son-in-law Andrew, and friend Joe. Thank you much for being here. We also have Dr. Vincent's, the CEO of Rome, the organization that Dr. Vincent worked for, Shannon Higby, and the CFO, Jacqueline Emborski, here today to recognize the memory of Dr. Vincent. And now, Kelly Asher, who was featured in the video telling her personal story, she's a veteran and also happens to work for the Department of Health, is going to speak to you now about why making this video was important to her. Kelly?
Good morning. I'm a member of an exclusive club, and it's one that we don't want any more members. And that is a club that has lost a loved one to suicide. Being a part of this video was just a wonderful opportunity for me to make a difference and try to reduce the incidence of suicide. In 2011, my sister, my best friend, she completed suicide with a firearm. The Lethal Means Project is excuse me a second. The opportunity for her to complete suicide would not have happened if we had been aware of the Lethal Means Project, the firearms had been removed from the home. She lived with her boyfriend at the time, and she was expressing suicidal ideations all day long. And he took his guns and he put them in the barn, and they weren't secure, but he thought that they were. And when she had a chance, she went and she found a gun and she completed suicide. If he had taken those guns and locked them up properly, if they had been removed from the home, this wouldn't have happened. She was in a crisis that was temporary, as people before me have said. It's usually temporary. It was a perfect storm for her. If we had been able to get her through those 24 hours and her medication had been straightened out, this wouldn't have happened. So I don't think she would have done it any other way. And studies show that people that attempt suicide, 90% of them don't try again. So I really think that if they had been removed, she would still be with us today. Her grandchildren would have a grandmother. Her children would have a mother. I would have a sister. My parents would have a daughter still. But because those guns were still there, she was able to complete suicide. Like I said, we don't want any more members to our exclusive club, and our goal is to make suicide numbers zero. That's what we're aiming for. I hope that the club is defunct. Thank you for listening, and I really want to thank the Suicide Prevention Coalition for the opportunity to do something to help with this issue. It won't bring my sister back, but it might save another family. It might save another life, and it might save another family from going through what my family has gone through. Thank you for this opportunity.
Thank you, Kelly. It's so important when people tell their stories, although it's so hard, because it helps others to have hope and to make a change. And now, just before we raise the flag, I'd like to mention this evening at 10 p.m., Niagara Falls will be illuminated in yellow, the official color of suicide prevention, and all of the Buffalo Lit Project, which includes all the iconic buildings in downtown Buffalo, will be lit in yellow. So if you have a moment, please step out and see that. We ask people to put a candle in your window between 8 and 10 p.m. to remember those we have lost, to remember those who are still suffering, and to remember the families and friends of those we've lost. So if you could do that. And now the county executive will help us in raising the flag of hope with vocalist Reverend Roger Griffiths of First Zion Presbyterian Church in Clarence Center. Thank you.
When I am down and oh my soul so weary, when troubles come and my heart burdened be, then I am still and wait here in the silence until you come and sit a while with me. You raise me up so I can stand on mountains. You raise me up to walk on stormy seas. I am strong when I am on your shoulders. You raise me up to more than I can be. Amen.
Thank you, Reverend. As you can see, we've come together as a community to say to those that are in pain, that feel there is no hope, hope does exist, and we are here for you. Please, please talk to someone. Call the helpline, 834-3131. We are here as a community to help you, and I do know better days are ahead. With that, I thank everyone for being here today on what this is a very important day. And we will certainly take questions from the media off to the side if there are any. Thank you, everyone. Be safe and well.